Let's take a look at the heart. So located here at the top are our atria, and located here at the bottom, these are our ventricles. So what tends to happen in a normal healthy heart is that blood flows from the atria to the ventricles and then to the rest of the body. And this whole system is really beautifully coordinated by an internal electrical system. So what happens in atrial fibrillation is that this internal electrical system becomes overridden by other electrical impulses elsewhere in the heart. And when this happens, you get different parts of the atria beating at different times. So this then means that you have a lot of stagnant blood. Clots can form a lot more easily. So clots then can travel from the heart through the body towards the brain, where the vessels are a lot smaller, and these clots can kind of get stuck. When they get stuck, you have less blood flow. This reduced blood flow can lead to a stroke. Atrial fibrillation, also known as AF, is a really common condition and affects around 1 in 45 people in the UK. Around 1 in 3 people with AF are actually asymptomatic, meaning they don't have any symptoms. And those who do have symptoms may present with an elevated heart rate, which might be irregular. Welcome to AduMed. If you're new to this channel, my name is Dr. Derek. Don't forget to leave a like and subscribe. And in today's video, I'm going to take you through what you need to know about atrial fibrillation, also known as AF, as well as stroke risk. Let's dive straight in. Let's take a look at a few of the common symptoms that we see in AF. Some of these include palpitations, chest pain, especially on exertion, the feeling of breathlessness, and dizziness. Now, it's really important that you see your doctor if you have any of these symptoms so it can be further investigated. So when it comes to AF, the thing that your doctor is most concerned about is the risk of a stroke. Now, we see this in the data. In 20 to 30% of patients who have a stroke, they would have had underlying AF. In addition to this, patients with AF that have a stroke have overall poorer outcomes and also an increased hospital stay. How can this stroke risk be reduced? Well, we have these medications known as anticoagulants. And these reduce the risk of clots from forming by increasing the amount of time it takes for the blood to clot. The decision on whether you need to be on these anticoagulant medications is based on a risk assessment done by a doctor. Now, this risk assessment takes into consideration common pre-existing conditions that increase the overall risk of stroke in someone with atrial fibrillation. Some examples of these include hypertension, diabetes, advanced age, and those with heart failure. The decision on whether anticoagulation is started is one that's made following a full discussion between the doctor and the patient. That is because anticoagulation medications can increase the risk of bleeding. Therefore, the risk and the benefits need to be really carefully balanced. In addition to this, not all patients will need to be on anticoagulation, as there are certain patients who have an extremely low risk of having a stroke. Therefore, each case is taken by a case-by-case basis, which is why you need to have the discussion with your healthcare provider. Thanks for watching today's video, in which we've taken a look at atrial fibrillation and stroke risk. As always, if you found the video helpful, don't forget to leave a like and subscribe. Also, make sure you check out some of the other videos on our channel. And until the next time, I'll see you soon.